Okay, so now we're going to talk about calculating fluid requirements. These are the maintenance fluids that your children need when they are NPO, or when they're not taking adequate oral intake, and they will have a minimum IV plus PO so that they don't get clinically dehydrated. These are based on the patient's weight in kilograms. And a problem that happens when students take the metrology test is they don't make that initial conversion from pounds to kilos. So please remember, you always need to calculate fluid requirements based on kilogram weight. As a child gets older, they get more muscle, more fat, and they are less percentage of water. But an infant is a greater percentage of water. So the smaller you are, the more milliliters of fluid per weight you're given. So our calculations for the first 10 kilos of your weight, you get 100 milliliters per kilo. So a baby who weighs 4.7 kilos, their fluid requirements, this is for 24 hours, what they need for their total daily requirement. We take 4.7 times 100 milliliters for each kilo, and we get 470 milliliters. They need that in a 24-hour period. So if they are NPO, because they're going to have surgery in the morning or something, and they order the IV to run at maintenance for this patient, what are we going to run per hour? 470 divided by 24 hours. The IV on this baby needs to be going 19.58, or we can say 20 milliliters per hour will give this 4.7 kilo child their maintenance fluids. If they have a fever, if they have drains, if they have wounds that are oozing, they're going to need more than this. This is only for the healthy child who doesn't have increased metabolic demands. They will need 100 milliliters per kilo. Now, as our child gets bigger, they have a smaller percentage per body size fluid requirement. So once we're greater than 10 kilos, so for every kilo greater than 10 kilos up to 20 kilos, each of those kilos are worth 50 milliliters per kilo. So an example, let's have a child that weighs 18.4 kilograms. So for the first 10 kilos, you have to take away that first 10. They get 100 milliliters per kilo, which is 1,000 milliliters, plus we have another 8.4 kilos that's in this category greater than 10 up to 20. That 8.4 times 50 milliliters equals 420. So we add that, and we get a total of 1,420 milliliters. Again, this is for the whole 24-hour day. So what they're going to need their IV to run at hourly, their IV would be 59.16, or we could just say 59 milliliters per hour for the child who's 18.4 kilos. Our kid is getting bigger. For every kilo greater than 20 up to 30 kilos, these kilograms only get 20 milliliters for every kilo. So let's have a 24.8 kilo child. We know we take away 10. 10 times 100 equals 1,000. And that leaves us with 14.8. The next 10 kilos, each of those are worth 50, is 500. And that leaves me with 4.8 kilos. In this category here, greater than 20 and under 30, those each get 20 milliliters per kilo. And that will give us 96 milliliters. So 1,596 milliliters in a 24-hour period, which per hour will give us 1596 divided by 24, 66. It's going to be too low for you guys. 66.5 milliliters per hour. Or we could just say 67 milliliters per hour for a patient who's 24.8 kilos in weight. And finally, for every kilo greater than 30 kilos, each of those, or fraction of those kilos, they get 10 milliliters per kilo. Now there comes a point when we have adult-sized pediatric patients that nobody's really calculating to the milliliter how much fluid they're going to get. But for your understanding of pediatrics, it's in our syllabi, and you're going to be calculating fluid requirements based on this calculation. So let us have a 57.3 kilo patient. So let me make this up a little higher so you guys can see it. 57.3. We take away the 10 kilos at 100 is 1,000. And that leaves us 47.3. We take another 10 away at 50 per kilo is another 500. That leaves us 37.3. We take away 10 at the 20 per kilo. That gives us another 200. And we're left with 27.3. 27.3 times 10, because every kilo after this is worth 10, is 273 milliliters. So this patient gets 1,000 plus 500 plus 200 plus 273, or 1,973 milliliters for that 24-hour period. Or 1973 divided by 24. Their ID is going to run at 82.2, we'll just say 82 milliliters per hour. Okay?